Okay, when I look to veins now, they are really different. Yeah, previously before the operation, there were huge veins, but they were normal in the laying down position. They were huge in this time. How was your Doppler report in UK? Did they say did they diagnose the varicocele?
No, I did it here. I didn't have a Doppler in the UK.
Oh, you didn't have. So, but how did you recognize that you have it?
Just very visible, obvious bag of worms symptom.
Yeah. And when you are in laying down position, there was really no veins, and when I make you stand up, it was very huge.
Yeah, exactly.
Now look, this is the spermatic cord, okay? Yeah. Left side is better now, and right side we still need some disappearing of the veins. Şuradan freeze bas bakayım.
Is that varicocele?
No. Let me show you. One of them is sperm channel. Look, this one. 1.6. Okay, very small.
Yeah.
Left it was smaller. No worries. Let's calculate this one. 1.7. Nothing.
Okay.
Smaller than 3 millimeters. It's nothing.
And they'll go.
Yeah.
Will they?
It was 4,
There was
5.
one that was 5. Yeah.
Yeah, these all looks now. Oh, are they large? No, they are. They are 1.5, 2. Freeze basalım tekrar. Your right side was more than I expected, and it is the remaining ones are now again larger than left part, but these are nothing. No varicocele, and they will disappear by time. Oh, it's fun.
How come they'll disappear? What?
No, actually, this is 1.4. That doesn't need to disappear.
Right.
Of course, there is a blood flow to testicle, and it has to come back.
Yeah.
So it's nothing. Let me see the blood flow now. Okay, this is the spermatic cord, and in the middle one was artery. It's not a vein. Yeah.
Is that healthy blood? Is that okay?
Yes, yes.
Right.
It's coming to testicle. You have big testicles, so there will be a little. I'm sorry. Okay, it seems better now. Strain a little bit. Strain now. Yeah. So look at the vessels, and let's see that without color they are more easy to see. All tiny little vessels. No, I don't have. I close the color now. So previously it was a 5 millimeter large, huge vein. Now these are small guys.
Yeah, 1.5, 1.4 on the other
Yeah.
side. Oh, great.
This part, for example, this is the largest one remaining. There are sometimes some veins that we couldn't take it out. Freeze a bit more. These are unimportant, and this must be less than 3 millimeters. It's 2.3 millimeter.
Yeah.
This is nothing, and it will be smaller by time. Normally,
What's that centimeter in millimeter?
yeah, 2.3 millimeter. So it must be lower than 3 millimeters.
Right, I see, yeah.
Yeah, this is good. Okay, so the wound dressing is good. Swelling, there is a swelling, but it is normal. So you will travel today, right?
Yes.
How do you, after the 2 days after operation?
I feel good.
Yeah, actually, I recommend to stay here a little longer, but you had this schedule, and yeah, 2 days after the procedure, it's possible to go, but I want you to be careful not to exercise. You are a muscular man, you are doing exercise, but please don't do them. At least 1 month, do nothing. After 1 month, you will feel, but for another 3 months, don't increase the abdominal pressure. Don't do Valsalva. try to do other things like your arms, legs, but don't try not to increase the abdominal pressure.
Okay, so
Then you will
like
be, look here, very interesting. Yeah, it's in your case. This is a valve. You see that? This structure has its duty is when blood passes from it, it will never come back. It has some special valves, and blood goes in one direction, they can never go back. This is doing it, but still it was large, so we take this vein out, and when I open it, first time I open a valve to see what's inside, and very interesting. Here I open it with scissors. Yeah, and look at this sac-like part. I push the instrument, it can't go to the testicular side. It is closed. This both side is closed. But then I will find the part in the middle. Yeah, in the middle. Look.
yeah.
You see, in the middle there is an opening. It go to testicular part, but the both sides there are sac-like parts. So when blood go from past this part, it will never come back. So this is the aim of a valve, and in my life it's my first time I see that.
Really?
Yeah, I opened a valve. Normally we resect them and send them. And look at these. Look at this vein. It was in the right side, very swollen. So we take it out. Yeah, when we take it out, I am very confident with the success of the procedure. It is gone. Of course, there will be blood vessels feeding the testicle. There will be blood circulation in the testicle. If we cut artery, everything will finish. Testis will go atrophy. But now we save the arteries. Blood is going to testicle, so it has to come back. There must be veins. So sometimes when I put the ultrasound, patients say, "Oh, there are still veins." Of course. There will be veins, but these veins will be smaller than 3 millimeters. They must be small. Look at these veins. We take them out in your procedure. And we usually, I love to write it. It's just sometimes I have hundreds of pictures of veins. So before the procedure, as you remember, there were huge veins. Now they are gone. If it was a normal, conventional procedure, we would ligate it here, cut the between, and this part will be more swollen now. So this is second day after the procedure, and this is gone. There are only small vessels which is needed for the circulation. So this was left side, I think, and yeah. So this is the right side, and it was again a 5 millimeter vein. It's all gone now. So this is good. What I recommend now, why these veins happened in your case, 15% of the population have varicocele disease, but especially you are making, how do you call, weightlifting or bodybuilding?
Weightlifting, yeah.
Weightlifting. Okay, so it's a risk. It's a risk for varicocele. Of course, you look very healthy. It is good. Everyone wants to be in a good shape. So I will not recommend, hey, people stop doing weightlifting and bodybuilding. No, it's good, but some of them will have varicocele disease, of course. When you have it, when you have the procedure, now they are gone, but still you have the risk. And I want you to stop doing it for 1 month. Then for 3 months, you have to be very cautious and don't increase the abdominal pressure. Do your works for the arms, legs, such things, but don't increase the pressure. Then after 3 months, if someone has the chance to come here, okay, that's good, but if not, do a Doppler, Doppler ultrasonography in your country. And you live in London?
Yeah.
Okay, so you can find these facilities. Of course, it's a little tricky in NHS, but
Yeah.
I don't know how you will perform, but do it. Send it to me. If you can't, come for a summer holiday and because if you want to continue with weightlifting, exercising, we have to see that it is over.
Well, I can come in the summer.
Yeah,
Sure.
it's an sometimes it is easier. Sometimes nowadays many people are coming here to buy some medications or do some checkups, such things, just for laboratory or radiologic examinations. They come, stay in Istanbul 2 days, finish everything in 2 days, and go back. It's also possible.
Okay.
So now, other than this, we usually give a supplement to increase not the sperm quality only, to increase the healing, recovery, to hasten, quicken the recovery. I will give you these medications. You will start them 1 month later. So first month use nothing, do nothing, just rest. After 1 month you will use them for 3 months, and after 3 months do a Doppler, do a sperm count.
Okay.
This is
What's in the supplement?
So I will give you it has some ingredients to increase the sperm production and recovery of the tissues, healing of the tissues. Such it's a supplement. Are you using many supplement-like things for bodybuilding?
No, I take a lot of supplements for various different. So some for sort of hormonal health, some for it's my line of work as well. So I took horse chestnut extract a lot for the varicocele before.
Yeah.
It can reduce the swelling a lot, but only temporary.
Yeah, no.
Doesn't
I
work.
think maybe it's better to use what I recommended because I have experience on that.
Oh yeah.
So it's better to make a standard recovery, standard healing. Okay, so thank you for coming. And what's your comment? Is it possible to come from England for a trip, varicocele, and go back? How do you feel? What's your recommendations? What do you recommend us to? How can we improve our?
I think the information you have on your YouTube is amazing. Any questions I had, I could find the answers on there, and that gave me the confidence in coming here. When I came, I spoke to you once on the phone. Arrived on the Sunday, had the control Monday morning. So easier than I thought. The control was fantastic. The hospital was fantastic. The surgery was seamless. I've had 2 surgeries in the UK, one on my shoulder, one on my back, both on private, the best you can get in the UK. This is just as good, if not better. So I would really recommend anyone to just make the trip and do it. And it's really feasible, it's doable, definitely do it.
Actually, there's a little tricky situation. Now the government pushes us to choose only one hospital. I was operating in 2 hospitals. One is the one you have, more fancy, more luxurious, good looking, and one is more economic. So I had to choose one of them, and okay, maybe 20% of my patients was choosing the expensive one, 80% was choosing the economic one. So I choose the economic one. So you were the last patient.
Really?
Yeah, we did it in this expensive hospital. I don't know. We give it to a court and we make I don't know how to say. So it will be studied again, this law. Maybe it will change because it is not fair. Some people want to buy a more luxurious service. Some people want a more economic service. So it's not fair. But maybe a couple of months we will be in the economic hospital.
Okay.
What's the difference? Actually, for me, nothing. I use the same instruments. I have my own Doppler, microvascular Doppler device. Everything is same. Everybody have concerns about these ligating clips I use in the operation. They are not present in the economic hospital because they are really these clips are too much expensive, but they ease my job very much. So I love to use them. But now I don't have the facility to use them. I will ligate in the old way. It's maybe a little lengthening my period. Other than that, microscope, we use Zeiss microscope. It's a German brand. It's very good. And this is the microscopic view is same, but from outside when you look which one of them is very fancy, good looking and everything is automatic. You can say zoom, it zooms. You can say zoom out, it zoom out. But the other one, you have to zoom like the old way with your hand. You have to adjust the zoom and focus, but it's the same. Sometimes the old microscopes, you know, it's the classic microscope. The view is sometimes better too. So the only difference is that, and of course the hospital quality, hotel quality is a little low level in that part. But we have to do. I don't have any chance now. So I hope it will change after some time. Of course, it is cheaper. So this is a better, better part of this change is that. So anyway, I have to do like this because the government wanted to push us like this. I don't know why, but it happened. So yeah, we will see. Thank you for coming. Thank you for these explanations. And yeah, we will be in touch. I follow up my patients from internet, from WhatsApp talks. Don't worry and keep in touch.
Great. Well, thank you very much, and thank you to your assistant as well.
Thank you.